Direct-to-consumer genetic tests like Ancestry or 23andMe are ideal for finding out about your heritage. However, when it comes to checking for gene mutations or illnesses, these tests are not always reliable. Here to share more is Dr. Gail Vance, a member of the College of American Pathologists Personalized Healthcare Committee. Good morning, Dr. Vance. Great to talk to you from Chicago this morning.
Good morning, JJ.
Well, this is kind of a new topic to me, I have to admit. What is the deal with direct-to-consumer genetic testing?
Well, it's growing in popularity. A lot of people are doing it, but they may be doing it for different reasons. So one of the cautionary notes that I would share with your viewers is know why you're doing the testing. Know what the test will say and what the test won't say. In other words, what it will tell you and what it won't tell you. So for instance, as you've already mentioned, there are companies that will look at just ancestry, look at who you're related to and past relatives, maybe Vikings or cousins in Iceland, etc. But if there's health-related concerns with these testing, that's when I would exercise a cautionary note. Because it's important to know, again, what the test not only will tell you, but what it won't tell you, but also really to understand for yourself what you want to know and what you don't want to know. Do you want to know about your risk for breast cancer? Do you want to know about your risk for Parkinson's disease? Do you really want to know about your risk for Alzheimer's disease? If you don't want to know, then don't take the test.
Absolutely.
The other important aspect of this testing is to make sure that the testing is performed in a CLIA Certified CAP accredited lab. In other words, a laboratory that's abiding by the federal law, or with a CAP accredited lab is abiding by standards that are above the law. So you want to make sure that that result that you get is an accurate result.
No, and I appreciate you giving consumers a heads up. You know, as genetic testing becomes more and more popular, there are more companies who offer it, and you want to be clear on what kind of information you're getting and making sure the information is legit.
Right.
You know, the holidays are coming up, and quite frankly, a lot of people think this is a really fun gift idea to give a family member. What would you advise as far as what a truly valuable gift would be?
Well, it's a good question to ask because the holidays are coming, but fun may be finding your ancestry. Again, do you have cousins in Iceland, etc. But again, you should know who you're giving this gift to because they may not want to know their health-related gene tests. They, as I said earlier, they may not want to know about their risk for breast cancer. And not only does it pertain to the individual that's doing the testing, but it pertains to the family. Because if it's a genetic test result, it's a family test result, and the family may not want to know either. The other thing that I would say that it's really important that it's interpreted in the context of the individual's medical and family history. So they may want to use this test and take the test result to their physician. So it may have ramifications beyond just going to a website.
Well, it's interesting, Doctor, I know that you were recently at the College of American Pathologist annual meeting. Was this topic on the tongues of all the doctors, genetic testing?
Yeah, absolutely. We want to make sure that the testing for patients is done accurately, that the laboratories follow standards, and the patients can be reassured that their test results are accurate. So again, I would say anyone who does a DTC testing should understand how that laboratory, is it producing accurate results, is it CLIA certified or CAP accredited, and find out before the test comes back, before you do the testing, that the laboratory that's doing that testing is a standardized laboratory.
Doctor, thank you. Yes, we want to make sure everybody makes note of the certification of the test they're doing. Thank you so much for the information this morning.
You're welcome.
If you have any questions or if you're curious about direct-to-consumer genetic testing, visit the website that is right there on your screen. That's yourpathologist.org. College of American Pathologist is a proud sponsor of the Morning Blend.